Hello everyone, welcome to my YouTube channel. Today class on surgical instruments and their uses. If you are preparing for NORCET, RRB or any other nursing exams or want to build your clinical knowledge, this video will help you. Myself Rakesh Kumaran, working at AIIMS Hospital. In this video, I will cover important surgical instruments like retractor, forceps, dilator, scissors or etc. So let's get started. Doyne's retractor used in abdominal and gynecological surgeries. Devers retractor, large curved retractor used for abdominal or thoracic surgeries. Langenbach retractor, retract soft tissue in general surgery. Morris retractor, used to hold back tissue and organ during surgical procedures, particularly in abdominal and pelvic surgeries. In these three instruments look similar but has some different. LV retractor has long flat handle with right angled narrow blade. Retract skin, soft tissue and superficial muscle layer. Provide exposure in superficial to moderate deep wounds. Morris retractor, large handle retractor with a right angled broad and strong blade. Morris retractor blade much wider and longer than LV retractor. Commonly used in laparotomy, abdominal and pelvic surgeries. Doyne's retractor, large handle, broad and curved blade, much wider than Morris. Used in deep abdominal, especially in laparotomy and bowel surgeries. Balfour retractor, used in abdominal surgeries to hold open the abdominal wall. Joll's thyroid retractor, commonly used in thyroidectomy surgery to provide exposure of the thyroid gland. Army Navy retractor, used for superficial wound and small surgical site. Journey retractor, double-ended retractor used in abdominal surgeries. Catspaw retractor, small double-ended retractor. One end has sharp prongs and the other end may be blunt or toothed. Used in plastic surgery, hand surgery, orthopedic surgery and etc. Walkman retractor, used for superficial soft tissue retraction. Sen retractor, double end used in small incision and plastic surgery. Finochet retractor, used in thoracic surgery to spread ribs. Richardson retractor, retract abdominal and chest wall during deep surgeries. Skin hook retractor, retract skin head in delicate surgeries. C retractor, used in small and medium incision. Gelpi retractor, sharp self-retaining, used in orthopedic and spine surgeries. Master retractor, used in mastectomy surgeries and other surgeries. Thumb forceps, non-toothed dressing forceps, for holding dressing sponges or delicate tissue. Toothed forceps or dissecting forceps, for holding skin or tough tissue. Hudson forceps, delicate forceps used in plastic and vascular surgeries. Hallis tissue forceps, for holding soft tissue firmly but may crash tissue, so not used in delicate structures. Valsalom forceps, used in gynecological surgeries like hysterectomy, myomectomy, D&C, helps in pulling the uterus down during the pelvic operations. Valsalom forceps is a heavy forceps with 4 teeth at the tip. This is Hallis, multiple small interlocking teeth. In Valsalom have only 4 teeth, but Hallis forceps have multiple teeth, but both look like similar only. But Valsarum forceps little curved compared to Hallis as straight. Mosquito artery forceps used to clamp small blood vessels. Artery forceps for clamping larger blood vessels to control bleeding. Coker forceps for holding tough structures like fascia has teeth to prevent slipping. In this image we can see mosquito forceps, artery forceps, coker forceps. Look similar but they have different by size and tips. Mosquito is small and fine. Artery forceps is medium. Coker has tooth at the tip for holding tough tissue. Right angle forceps are mixtures for clamping or dissecting around structures. Backup forceps for holding delicate structures like intestine, fallopian tubes. Green Armitage forceps used to hold the uterine edge at cesarean section. Myoma screw used in gynecological surgeries, specifically in myomectomy, removal of uterine fibroids. Ovum forceps used to remove the ovum or product of conception during the procedures like curettage or early pregnancy management. Uterine sound used to measure the length and direction of the uterine cavity. It is commonly used in gynecology and obstetrics. Bladder sound used to explore and dilate the urethra and bladder. It is commonly used in urology. Loop hook used to remove IUCD from the uterine cavity. Agar dilator used to dilate the cervix for gynecological procedures. Havkin-Ambler cervix dilator. Iris spatula used to collect pap smear. Punch biopsy forceps used to take biopsy from the cervix. Sims speculum is a double-bladed vaginal speculum used to examine the vaginal canal and cervix. It is commonly used in gynecology and obstetrics. Sims speculum, single-bladed speculum, is a vaginal speculum with one blade used to retract one side of the vaginal wall for examination or procedures. Cuscus speculum is a bivalve self-retaining speculum commonly used in gynecology to examine the vagina and cervix. EB curette used for scraping and removing tissue from the uterine cavity. It is commonly used in gynecological procedures. Novak curette. It is a uterine curette used in gynecological procedure to remove tissue from the endometrium or uterine cavity. Lens tissue forceps for grasping tissue. Magill's forceps used to guide on endotracheal tube or remove foreign bodies from airway. Laryngoscope blade. Macintosh, Miller, Wisconsin, Oxford. Chittle forceps used for handling sterilized instruments and dressing items. Sponge holding forceps used to securely hold sponges or swab during surgical procedures. BP handle used to hold and control surgical blades during procedures. Thank you for watching this surgical instruments class. I hope it was useful. Don't forget to like, share and subscribe for more videos.